Definition, classification and complication of heart failure. Definition of heart failure. Heart failure describes the clinical syndromes that develops when the heart cannot maintain adequate output and do so only at the expense of elevated ventricular filling pressure. It is the clinical syndrome that develops when heart cannot maintain adequate output. This is blocked coronary arteries, and this is dying muscle or damaged tissue. In case of dying muscle or damaged tissue, it cannot pump blood adequately. Heart failure describes the clinical syndromes that develops when the heart cannot maintain adequate output or can do so only at the expense of elevated ventricular filling pressure. Classification is done on the basis of different issues. First of all, on the basis of ventricular involvement. On the basis of ventricular involvement. On the basis of ventricular involvement, it is of three types: left ventricular failure, right ventricular failure, and finally biventricular failure, which occurs in congestive cardiac failure, biventricular failure. Next, number 2, on the basis of circulatory failure. Failure, it is of two types. Number 1, forward failure, and number 2, backward failure. Next, on the basis of diastolic or systolic dysfunction. On the basis of diastolic and systolic dysfunction, it is of two types: dysfunction, diastolic and systolic dysfunction. It is of two types. Number 1, diastolic failure. Number 2, systolic failure. Diastolic failure, it occurs when heart fails to fill completely, and systolic failure, it occurs when heart fails to strongly pump out blood. These figures describes clearly the diastolic and systolic heart failure. In case of diastolic heart failure, where heart cannot fill completely due to stiff and thick chambers. And in case of systolic heart failure, where heart cannot pump out blood strongly, it occurs due to stressed and thin chamber. Number 4, high output failure. These conditions are associated with a very high cardiac output, and they are usually having a hyperdynamic circulation. High output failure. Number 4, high output failure. This is caused by severe anemia, then thyrotoxicosis. Number 3, beriberi. Based on duration and onset of heart failure. Duration and onset of heart failure, it is of two types: acute heart failure and chronic heart failure. Acute heart failure and chronic heart failure. Complications of heart failure. Complications of heart failure are electrolyte imbalance, organ failure, cardiac arrhythmia, thromboembolism, and sudden death. First of all, electrolyte imbalance. Electrolyte imbalance includes hypokalemia, hyperkalemia, and hyponatremia. Hypokalemia, hyperkalemia, and hyponatremia. Decrease of sodium. Number 2, organ failure. Organ failure. This includes renal failure and liver failure. Number 4, thromboembolism. It's the example of thromboembolism. What is thromboembolism? Thromboembolism is a vascular disorder. It is a vascular disease characterized by obstruction of the blood vessels. It may be arteries or veins due to the formation of embolus, which originates from a blood clot or thrombus. What is embolus? Embolus means movement of blood clot from one place to another. Based on the location of blood clot formation, they are classified into venous thromboembolism, which occurs in veins, and arterial thromboembolism, which occurs in arteries. Thromboembolism. Finally, number 5 complications of heart failure is sudden death. So if we review the topics, definition of heart failures. Heart failure describes the clinical symptom that develops when heart cannot maintain adequate output. That means cardiac output is not up to the mark, or to meet up the demand of cells. Classification of heart failure. It is classified into different types on the basis of ventricular involvement, circulatory failure, diastolic and systolic dysfunction, high output failure, and based on duration and onset. Number 1, on the basis of ventricular involvement, it is of 3 types: left ventricular failure, right ventricular failure. Finally, biventricular failures, which occurs in congestive cardiac failure. Circulatory failure. Circulatory failure are of 2 types: forward failure and backward failure. On the basis of diastolic or systolic dysfunction, it is of 2 types: diastolic failure, where heart fails to fill completely, and systolic failure, heart fails to strongly pump out blood. High output failure. These conditions are associated with a very high cardiac output, and they are usually having a hyperdynamic circulation. It occurs due to severe anemia, thyrotoxicosis, and in beriberi. Based on duration and onset, it is of 2 types: acute heart failure and chronic heart failure. Final topic: complications of heart failure. Number one, electrolyte imbalance. Number two, organ failure. Uh, organ failure. Number three, cardiac arrhythmia. It is missing. Number three will be cardiac arrhythmia. Cardiac arrhythmia. Number four, thromboembolism, and number five, sudden death. Electrolyte imbalance includes hypokalemia, where potassium ion decreases, and hyperkalemia, potassium ion increases, and hyponatremia, where sodium ion decreases. Organ failure includes renal failure and liver failure.